Let's see if the internet holds. The internet just died there. So just talking about the symptoms. I'm talking about anxiety in children, and I've just picked it up from what I was saying before the internet just died. Let's hope this holds for a bit, otherwise we'll have to change sources. I was talking about teenagers and the symptoms that they may show when they have anxiety, which is they can express it more, so they can, they'll have upset tantrums, but they can be disconnected. It depends whether they internalize or externalize their anxieties, and a variety of other symptomology. But you tend to know children who are younger, of course, teenagers will get sleeplessness and other physical symptomologies like headaches, tummy aches, problems with their menstrual cycles, etc., etc. There's a lot of different symptoms that can be physical from anxiety in a teenager. When they're younger, children tend to get actually very much more physicalized symptoms. They can have night terrors, fear, terror being alone, having to be with mummy, be held by mummy the whole time. But they also get tummy aches, and they could say, I just have a sore tummy, or they have headaches, and that could be the only symptom that they have, or they wake up crying in the night, etc., etc. I mean, it's wide. And how do you diagnose someone with anxiety? Every child feels anxiety at some stage. It's is it a problem? When is this actually becoming a problem? When it's overwhelming, when they feel overwhelmed by it, when it's affecting the normal quality of their lives, that's when we start to have concerns with it. And when I was first working 25 plus 30 years ago, you'd see children with anxiety who are teenagers, unless there'd been trauma. And then as the years went, 15 years ago, you'd be seeing 10-year-olds with symptoms and signs of anxiety, then it drops down to 7, 8-year-olds seeing a lot of, and then 4-year-olds nowadays. It's getting younger and younger and younger, and we'll talk about why that is and its possible consequences and causes of that in a little bit. But it's a problem because it's more across the ages of children, and it's not just your classic kind of teenage related anxiety strained patterns. So I'm not going to talk too much about the different parts of the brain that are involved. If you want reference to that, that's all in my last talk, which you can get on the YouTube or this Facebook page, or the Dynamics of Stillness, etc., and how the anterior cingulate cortex is affected and the prefrontal cortex interrelates with it, and the function of the hippocampus, and how the prefrontal cortex consciousness can override pre-conscious reactions in anxiety, and how sleep rhythms and are very important, shortwave sleep and REM, all covered before. So, but I still will talk a little bit about the amygdala here, because the amygdala is the troublemaker. And I think it's important to highlight that again. I talked about it a lot more last time. This is the brain's early warning system. It governs our pre-conscious reaction to threat. It assigns emotional significance to perceived threat. Perceived is a key word. And wires it in. Sensitive, the amygdala, is to non-verbal signals. So, for example, caregivers' facial expressions, anger in the voice, for example. And the amygdala, as we know, sets up this prefrontal cortex modulation. It sets up wires straight into the hypothalamus, where you've got CRH, ACTH cascades, hypothalamus, pituitary, adrenal, boom, wires it up into this fight-flight reaction. And there we go. We've got symptoms and signs manifesting of anxiety. So, the more it is engaged, the younger it is engaged, the more it is wired up. We hardwire our brains by the way they are used. So as young children, if we, for example, learn a language, we can hardwire that language in through the synaptic wiring up, or if we learn to play a sport, we hardwire it much younger into our brain. So actually it's more functional. Same exactly with anxiety. We can hardwire it, and we have to be very active in changing these patterns early on before they hardwire in. I mean, just coming back to that idea of threat, the amygdala responds to threat, which was fantastic in the days where we were hunter-gatherers, and there's a wild lion, say, out there. We've reacted, we've run, we fought it, or whatever, we've shut down before we can even think about it. The reaction is pre-conscious, and that is, the amygdala was fantastic for that. But what is perceived threat nowadays? What do children perceive as threats? It's very different. Is it sensing parents' insecurity about finance, say, or is it the pandemic daily news? Of course it is. Is it social interaction? Actually, is it the opposite to that? Is it lack of social interaction? This last week, a lot of kids going back to school, a lot of kids are really anxious because they haven't had the connection with their peer groups that they've had for the last year, and they're understandably anxious. And then their only form of communication is social media, even from a youngish age, and that wires us. So, are these more subtle fields with anxiety? There are subtle triggers that can allow the body to perceive threat. You have this in adults, certainly, where a feeling of just disquiet, or the body doesn't feel right. Some of this inner sensory awareness of the body, interoception, something doesn't feel right and in yourself, and that sets up a reaction. So these are cascades of reactions, and so there's a lot of things we can look at when we're trying to address this in children, and we'll come to that a little bit more. So what sets this up? What can set up these reactions? And this is more interesting, I think, for practitioners to look at and work with, because this is where we can come in and really change the dynamics of it. So starting with, very early on shock in the system, in the physiology. We're talking prenatal, from the beginning of pregnancy to later prenatal embryo dynamic stuff, where there could be some sort of micro changes in the vascularity, or mum has an infection, or mum has high blood pressure or diabetic changes in pregnancy, mum is stressed, etc., etc. These they set up the tone to some degree in the HPA axis in a baby. Then you've got really clear things like perinatal trauma. So shock, a baby who, a normal birth process can involve, if it's too fast, or there's too much compression, or it's managed to happen too fast, too much oxytocin, so the contractions are too hard. The usual thing, managed traumatic physical trauma from ventouse or forceps deliveries. Even emergency C-section leaves a baby in a state of recoil. Even in an elective C-section can leave a baby in a state of recoil. The recoil is like a shock, and it can set up a tone in the HPA amygdala and a sensitivity in the amygdala. So you've got all of that. Also, there can be if the mother is shocked by too fast, too strong, episiotomy, etc., not managed within the rhythm of a beautiful rhythmic birth, and the mother is holding shock in her field, the baby will react preconsciously to that. Okay, sets up tone. So the CRH, corticotrophin releasing factor or hormone, actually, you create more CRH producing cells in the hypothalamus and more receptors in the hypothalamus, and it becomes more sensitive, the anterior pituitary, to CRH, and more reactive. So actually it sets this pattern up. So important, there isn't nothing you can do about that, because we can treat the effects of because it's a physical, energetic recoil that's in the body, and you can allow that to unravel by treating the mother for their shock, treating the baby. I've talked a lot about shock in previous ones. Please refer to my previous talks. They're all there on trauma, on shock, and how the physiology responds to it. So that is important to address. I've talked about it before, so I'm not going to go on to it too much. So then you have emotional, you have emotional trauma and perceived threats in children. These are processed pre-consciously. They're processed and held in the body of children, certainly under the age of 7, I think, really. It's only starting to really employ enough true consciousness to actually, be able to identify and process things do we ever? It's different. We maybe we do increasingly so, but certainly children hold stuff in their bodies. They hold trauma in their bodies, and then you've got you've got trauma, and working with children who have trauma, they hold it in their bodies and they respond wonderfully well to physical based therapies, where they can release some of the trauma that's held in their body. But often it's more subtle, the emotional, relational fields in which they are in terms of how the dynamics of the family is, etc., the dynamics of their social interactions. The thing is we live in this age of anxiety, this overstimulation of the senses, and we have to remember with the amygdala that the senses are one synapse away from the amygdala. There's no processing. It goes straight. The senses are processed in the thalamus, one synapse back, bang, they're straight into the amygdala. So the amygdala is oversensitized by overstimulation of the senses, which is always trying to filter what is threat, what is not threat, what is threat, what is not threat. Our most primitive reflex is to move away from threat and move towards nurture. That is actually, if you think about it, that's the fundamentals of life. And so as a brand new baby, that's what we learn, and that's how we relate to life. So if the senses are overstimulated, overwhelmed, the amygdala becomes sensitized. So, the idea of blue screens, our little screens that we're doing everything on, gamma ray, irritation, the nervous system is electrical. It functions electrically. So if we're in electrical environments, it stimulates the brain, as opposed to natural rhythms of nature, the rhythms of nature, this idea of stimulation of the senses as opposed to rhythmical, flowing play, which is spontaneous and natural. And the nervous systems of children who are in that natural rhythm their rhythms are slower and they are spontaneous, and they are in what we would call a degree of natural neutral. That's how they are. That's how they're supposed to be. But actually that gets lost because of this overstimulation and all these other things that we've talked about. Another thing that I want to talk about is age appropriateness. God, as a parent, I remember when my kids were younger, it's so easy to fall in that trap of being unage appropriate in what you're talking about. We have to be really careful as adults what we say to children. Yeah, we shouldn't adultize children because they cannot process things in the same way. You can't talk to them about stuff it's important not to hide things from people, but it has to be kept rhythmical and simple, and stay away from the news, and say, and it's not shying away from the reality of life. That's not what I'm talking about. I'm talking about complex socio-dynamic issues with children who don't understand it. They'll just have a reaction of threat and fear to it. Stay away from the news. It's just a barrage of trauma. That's it. And we all know that. And it sensitizes our brains, our amygdala. Everything is a threat. Boom, boom, boom. So, children, I think, need to keep in nature, keep natural rhythms, spontaneous play, simple simple discussions, important discussions. If there's something important, someone's sick in the family, you don't hide away from it. It has to be talked about, but very simply, and saying, but you're safe and you're fine, but this is what's happening. But not talk about the complex psychology of it. That's a disaster for children because they can't process it, and they shouldn't. It's not fair. So, yes, I mean, I suppose what we're doing is we're leading on to what we can do. What can we do to help this? What can we do to make... I mean, as practitioners, obviously, you know, you want to deal with what has possibly set up this tonal thing. It doesn't... Sometimes it's nothing to do with that. Sometimes there is no perinatal or postnatal postpartum shock or anything like that. Sometimes it is just their social emotional environment, or there's genetics, epigenetics. You know, mother has anxiety, or dad has anxiety, or grandmother has anxiety. Now, that is environmental, you know, because we learn by mimicry until we're 7 years old. So, you know, if mum's anxious, it's hard for us not to have some degree of anxiety, but that's okay. That's not something to judge. We just need to simplify things for them and keep some degree of rhythm, and as best we can deal with our own anxiety, for example. You know, and working with this cranial work, you know, this idea of this cranial rhythmic impulse, this rhythm, this natural rhythm in the body that has different rates, and this idea that the normal rhythm of a child whose brain's in neutral, not in a state of anxiety, say, there's this 2 to 3 cycles per minute, which is what wild animals are in, and people when they're relaxed are in. There's this nice rhythmical, it's like cellular metabolism, breathing, and everything's breathing. I mean, you can teach anyone to feel this in 5 minutes. It's a very simple thing to feel, actually. The interesting thing is this cranial rhythmic impulse, of course, in wild animals who are in distress, or adults who live in the city, or if there's any degree of distress, this rate goes up to 8 to 12 cycles a minute. That's a state of distress, you know. That tends to mean that, you know, the pulse rate's higher, the respiratory rate's higher, the actual breathing, what we call secondary respiration rate is higher. So actually, as practitioners, to actually allow the child to come to some degree of neutrality in themselves is a starting point. You know, I'm not going to talk about this with regards to practitioners because there's a whole world of stuff that's all relevant for that. But, you know, by nature, cut down screen time, get rid of, reduce these social media. But encourage them to talk about how they feel, I think, with children, but not analyse and conceptualise with them. That's the worst thing, I think. God, you know, I know. Having learnt slowly and the hard way, you know. But there's empathy. I understand, you know, saying, I understand that you feel distress, but you are safe. You know, simple. Within what bounds they can be safe, you know. So I'm just going to introduce just a couple of little simple things that we can do if there's a child, and you can do this actually in... I think probably above 5 and up to about 75 to calm down anxiety. We'll start with the first one, which is a very simple breath breathing. So this is kind of vagal breathing. So this calms down, it stimulates the vagus nerve, calms down the HPA axis, calms down the whole adrenaline side of it, the whole cortisol, adrenaline, HPA side of it. And it's simple. What it is you take a breath in through your nose, and then you breathe out through your mouth, okay? And the breathing out is double as long in time as the breathing in. Very simple, really. So breathe in and breathe out. And now what that does is that stimulates the vagal nerve, right? And calms down the nervous system. It's very simple. Just do it for a few minutes. A nice thing to add into that, a very simple thing, is to add it as you breathe out. Let go of your tension. You know, we're hopefully not going to hyperventilate here, but just lengthening the out breath. And actually, I find it's easier if you breathe out through the mouth. You can just let go of any tension that's accumulated, and just a minute or so of that, just letting go, bringing back to balance, bringing yourself back into a place of relative neutral. And if you get children to learn that just that simple technique of bringing a bit of consciousness to their breath and lengthening their out breath and letting go on the out breath, this should be taught in classrooms, basically, just allow children to really restore. And actually it is being, I'm sure, in certain schools. So that's number one technique. Number two technique is the idea of a safe place meditation. Okay, so what we're creating is a place in their heads to go if they're feeling anxious, a place that is safe. And it takes a little while to construct this. And you can do this with them. And they need to be reminded of this place. And so it would go something like this. Can you think of a place in the world where you feel safest? Now, it could be in grandma's house, by the fire, being cuddled by grandma, or it could be in your living room with the cat, or it could be by the sea, or it could be their favorite place. It's nice that it's a room or it's safe, or if they don't find one, create one. What could be the most beautiful place? Could it be in this incredibly strong castle, which is fortified by giants outside, and it is the safest place in the world, and you know that you're being held, and it's full of cushions, and it is beautiful, and it's painted bright red, nurturing, warm, and soft walls, whatever, yeah? Really explore with the imagination the place, and then you get them to bring in their senses. What does it smell like? Close your eyes, smell that smell. What's the loveliest, safest smell in there? What does it sound like? Is it the sound of the sea, or is it the sound of crackling fire? Is it the sound of grandma, or is it some Irish music playing, or is it what is it? Something that brings them to a sense of safety. So you use visuals, so they picture it in their mind's eye. Use audio, so you can, what's that sound? What does that sound like? Or is that mama's heartbeat? What does it smell like? What are you sitting on? Are you sitting on cushions and rugs? Who's with you? So you create this room, this space, this safe place. This safe place, kind of like a safe place meditation, isn't it? They're a place where if you're feeling nervous, you can come into there and you're pre-setting this as a place where the nervous system can come to neutral in a child. So you're informing them consciously that this is where you become calm. So when they need to, you say, okay, let's sit quietly, hold my hand. I know you're feeling anxious. Let's just go back to that place. What does it smell like? What does it sound like? How does it feel? What's the texture? Bring the senses, the imagination through the senses, into the environment, the perceived environment, which is safe, no matter how unsafe things are in the external world. This is our safe castle, or our safe log in the woods, log house in the woods, or our safe room. It doesn't matter what it is, but if you create that with them and reinforce that as a place they can go, it's hard, because when you're anxious, to actually take yourself into that place, you have to employ tricks. You have to do some vagal breathing, and then you have to engage with them through the senses. But if you can do that with them, it doesn't always work, but it can be actually quite helpful. These are tools, and with my kind of anxiety break stuff, I do lots of different tools like this it's not related to children, but these are all adaptive techniques, actually. And I've just adapted a couple of the techniques here that I use in the course with regards to children, and practitioners use them with patients who have anxiety, because in anxiety, if someone can empower themselves to, when you're feeling overwhelmed, to not feel overwhelmed, simply just to take yourself out of a place of feeling overwhelmed, is incredibly empowering, because you've lost control. And if you can gain that, or what is perceived control, and you can bring yourself to a place of safety for yourself, then there's nothing better. then you're on the right tracks there. So I mean, that's just a little introduction of a big subject, and I think a really important subject. More information on pediatric stuff for practitioners is my PG Cert part 1 in cranial pediatrics, which you can access on the dynamics of stillness. And I'll be back to you soon with some other discussion I was going to have. Someone wanted me to do something about feeding difficulties in newborn and how to differentially diagnose them. That's quite interesting. Anyways, I wish you well. I'm going to be coming back in about half an hour doing a meditation on light.